Hey babies, welcome to my channel, Donna P Howard. Lately I haven't been doing videos. I do some here and there, but I haven't been doing them as much as I usually would because I've been depressed. I am tired of dealing with all these different companies. You got your insurance company, and you got Medicare, and you got doctors, and everybody swears they know more than you do. So, first of all, I'd like to say that I've noticed when I was working many years ago and I was paying into insurance through companies that I worked for, they paid some and I had to pay some. To me, the service that I got from doctors were more professional and you get treated better. But when you have just straight Medicaid or straight Medicare, or a combination of Medicaid and Medicare, it seems to me like these doctors feel like they can say or do what they want, or these insurance companies, and you have to put up with it, and you don't. Now, when you go out on disability, SSDI, I have explained this many times before. After 2 years on being on Social Security Disability Insurance, SSDI, they force you to take Medicare, which is usually the insurance that most people look at as the old age insurance. You didn't work for so many years, or you didn't work and now you're 65 and you qualify for this senior insurance program. I qualified when I was 48, just straight up. Anywho, um, with the parts that I get with Medicare, I get parts A, B, and D. Parts A covers my hospitalization. So if I have to go to the hospital and stay, that's what Part A covers. Part B covers my primary doctor if I choose to have one, because you don't have to have one when you got Medicare. My specialist and my testing. So, like, if a doctor orders some tests, some of my testing is included under Part B and my medical equipment. And then for my prescription medications, it's covered under Part D, whether it's lotions, creams, eye drops, pills, liquids, soaps, gels, stuff like that. That's covered under Part D. So when you qualify for Medicare and they force you to take it, they tell you some parts of it, but they don't tell you all parts of it. First of all, Medicare only covers 80%. So if you have a high income, whether it's regular Social Security, Veterans Pay, or SSDI, you have to buy a backup insurance to cover the 20% that Medicare doesn't cover. Luckily, I am not in that situation. I have Medicare, I have Medicaid, I have extra help, and I receive a low subsidiary document every year. So with the Medicare, like I explained, I got A, B, and D. But if you want Part C, which is covering tests that are more advanced, usually Medicare will deny these tests unless you have Part C. But what I did was I jumped into a SNP program, a special needs program for people who have one or more chronic illnesses. I have a few. I have a mental health chronic illness, which is depression. I have rheumatoid arthritis, which is the crippling disease. And I suffer from blood clots passing in my heart and my lungs, which can kill me, along with other different medical issues. So that's what makes me qualify for the SNP program, Special Needs Program. So here in Buffalo, New York, there's two that I know of, and I'm not happy with neither one of them. The first one is United Healthcare. When I was on United Healthcare, I loved the benefits that it gave to the members. It was beautiful. You had parts A, B, D, and C. So you had the whole package, and that was great. But their employees do not know what to do. Or should I say, if I call in and I'm telling you I'm going through this, and that, instead of just being honest saying, oh, I really don't know. Let me, can I put you on hold for a minute and go ask the supervisor? They'll be asking you, oh, are you happy with my service that I did with you today? And I'll say, yeah, I'm happy with the service, but I'm not happy with the situation that's going on. And then they'll put it through like I'm happy when I'm not happy. So you're not helping me, you're hurting me. And in that situation, I wound up getting emergency surgery that I didn't necessarily need had they paid attention and hooked me up to the right person. But I do like the benefits that United Healthcare has. But they deal with Kaleida Health, which I've had a bad experience with them, and they deal with Erie County Medical Center, which I had a bad experience with them. So I don't do neither one of them. I don't care what you say. I don't care what you think. I don't care what you do. I don't care how much you in love with these organizations. I am not dealing with neither one of them. You couldn't pay me $1 trillion to be bothered with either one. So, my experience with ECMC is I don't trust them. When I was a teenager and I was raped and kidnapped and held hostage, of course, Buffalo police took me to ECMC, and when I went for a follow-up, they never heard of the doctor. I do not mess with ECMC. I don't care what you say. I don't care what you think. I am not messing with them. And I do have a doctor there, but his office is an outside building. It has nothing to do with inside the hospital. I am not going inside the hospital to see a doctor. If you have an office there or you have a clinic there, I will go in there one time. I'm going to tell you why I'm not coming in there. If you don't tell me I can go to your suburban office, or the insurance company won't let me go to your suburban office, I'm not coming back. Period. I don't care what you say. United Healthcare also deals with Kaleida Health. Kaleida Health, I was going to one of their clinics for OBGYN, and back in 2013 when I became disabled, the doctor told me the reason I had the blood clots is because I've taken birth control and I smoke cigarettes, and they should never have given me birth control because I smoked cigarettes. So when I got out the hospital after that and told them, they switched me out of the clinic I was in because I wasn't trying to get pregnant. I had no babies. I have one. I'm good with it. So they sent me over to a women's clinic in Children's Hospital, which that didn't make no sense either, because I wasn't trying to be pregnant or trying to have no baby. But the doctor there wanted to do a biopsy on me, and I was willing to do it. Crazy, crazy, crazy. Was willing to do it, and had to go run to all these different doctors. I had to get all these medical clearances. I had to go to Children's Hospital and get all this blood work. I had to get all this testing. My primary doctor had to clear me, did all that, all of it. Come the day it's time for testing, they got a list of medication from years and years and years in the past that I was no longer on. And being that I didn't have my list with me, they wanted to run with that. Okay, whatever. I don't even care. Take me downstairs. Try to put me to sleep. My veins is rejecting the needle. It's not even letting the needle go in my veins. They get the anesthesiologist. He tries. My veins would not work with him. They was not letting him hit me with no needle, no way, no how. While I'm laying on the gurney, while he's trying to hit me with the needle so I can go out, lo and behold, they can't find my clearance. So they can't do nothing until they find that clearance. I did everything they wanted me to do. That was God. And I was all right with it. Couldn't find my clearance for none in the world. None of the doctors I went through, none of the things I had to do for the hospital, the primary doctor, no releases, no nothing. They couldn't find nothing. So after they realized they couldn't get paid, they rushed me and whisked me out of that area. And that was fine for me because I had no business down there in the first place. And I'm not ever going back to a Collide Health facility. Ever, ever, ever again. All my doctors have to do with Catholic health systems. It's the hospital that I grew up with, Sisters. I'll either go to Sisters or St. Joe's. I am not going anywhere near Collide Health Systems or ECMC. Okay. So I leave United Healthcare because the only way United Healthcare pays for me to go to Catholic Health Systems is if I go through the emergency room, which is fine because that's where I go to the hospital. I go to Catholic Health Systems. I don't care what you say. I'm going to Catholic Health Systems, whether it be Sisters or St. Joe's. I'm going to Catholic Health Systems. So if I got to go through the emergency room, it's nothing new. They're used to me. I don't come that often, but when I come, I come. When I come, they look at my paperwork that I have about the things that I suffer from. I tell them what's going on. They throw me in observation. And before the day is even over with, if I need to stay, I'm already admitted. Whether I'm in observation or in the room, I'm already admitted because of the health issues that I suffer from. Not only does the rheumatoid arthritis make you become crippled, when you have rheumatoid arthritis, and I've explained this numerous times to you before, your system fights you. So if you get a cold and I get a cold at the same time, and we're both taking some kind of cold medicine, you're going to get better before I do because the medicine is going to work with you and your system is working with you. With me, the medicine is going to work with me, but my system works against me. It doesn't work for me in the proper way. It works against me. So everything that's coming at me that can be hurtful, I'm getting it all because I have nothing to protect me from a cold. I have nothing to protect me from the flu. I have nothing to protect me from anything, period. And it just is what it is. So for me, I cannot go to urgent care. I don't care what it is. I could prick myself on a thorn and it starts bleeding and it's bleeding profusely. I can't go to urgent care. I have to go to emergency room. Period. Point blank. We all know it, they know it, and it is what it is. But so since I picked to go to Fidelis Care, well now it's called Well Care by Fidelis Care. They changed the name. It's the same company. They changed the name. They give you benefits, but their benefits aren't as beautiful as United Healthcare. And I feel like since I got Medicare and Medicaid, and that's, you have to have both of these insurances to go into SNP program, whether it's United Healthcare, Fidelis Care, or whoever, then all these companies, they should be offering the same benefits to the members, but they're not. Okay, I can go to the hospital I want, but I can't get all the benefits. I don't like it, but I got to deal with it. And, you know, it is what it is. But what kills me is Well Care by Fidelis Care. They are a pain in the ass. They call me numerous of times. I'm not interested. So once I say I'm not interested, that representative should hang up and say, okay, goodbye. They want to call and tell you this. They want to call and tell you that. They want to discuss this. They want to discuss that. They're trying to show Medicare that they're truly invested in you and your health care. And I keep telling them, I run my medical. I don't let nobody run my medical. I don't let the insurance company, Medicare, nobody, Medicaid, nobody. I don't let nobody run my medical. I run it myself. If I want to go to this doctor, I make an appointment and go. If I don't want to go, I'm not going. Period. If you start talking stupid to me, I'm not coming back. It's my choice. I am the member. It is my choice of where I go, who I get care from, and when you get on my damn nerves, fuck you. I'm not doing none of that. That's my choice, not the doctor's choices. They have a tendency of talking at you instead of talking to you. I don't give a damn what you say. I'm going to do what I want. This is my life. This is the life that God gave me, and I'm going to do what I want to do. Period. I don't care what you say. So, okay. So now you're dealing with these stupid doctors. And some of them are so arrogant that they don't want you as the patient to tell them anything about you. They want to tell you about you. Well, that don't work. So, bye. That don't work for me. Then you got the insurance company. They want to be so involved. I'm not going to talk to you. That's just all to it. I'm not going to talk to you. They took it upon themselves because I had an aid service with them. And when you had the aid service with them, you had to get your medical cab through Fidelis Care. So they had my house number. And I gave them my cell phone number for transportation purposes only, because it makes no sense if I go to the doctor and I call from my cell phone for you to come pick me up at the doctor's office and you're steady calling the house number. That's how I wind up getting stuck with these cabs and stuck at a facility for 2 and 3 and 4 hours longer, because they don't have the common sense to call my cell phone. So Fidelis Care took it upon themselves. Well, she lets transportation use this number. I'm going to call it. No, you're not. I don't conduct business on my cell phone. I know there's a lot of people that do. I don't. That's what I got a house phone for. But you start partnering with all these little companies that say, oh, I got a benefit for your members and blah, 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 and we could do this and that. And you just give out my name, address, city, state, and zip, member's ID number, and my phone numbers like it's all right. I have two phone numbers. I have a home phone number. I have a cell phone number. I pay to have both of my phone numbers unlisted. So if I don't give you my phone number, I don't want you giving it out to anybody. But they act like they own me and they just gonna give up my information to all these different companies. And I keep telling them stop doing that. Take that number off of my account. They don't want to do that. Okay. Well, then I'm not gonna answer you. I'm not gonna answer you or that company. If they feel like their information is that important, put it in the mail. If I feel like it's important, I'll call back for more information. If I don't call back for more information, it wasn't important to me, period. I don't care if it's the insurance company. I don't care if it's these little minor companies that you keep dealing with and want to say you're giving your members benefits. We as members, whether we pay a copay or not, would like some benefits that we can utilize. Give us some gift cards. Not no low $10, $20, $25 gift card. That's a waste of my time. I wouldn't even pick up the phone for that. Give me $100 gift card if you want me to do certain things. But you want to get with these little companies and give out everybody's information. I tell them all, don't call me. I'm not interested. I don't want nothing to do with y'all. Because whatever you offering, it does not replace me having to do this test or this or whatever for the insurance company, for the doctor, for the primary doctor. I don't want that shit. Leave me alone. Okay. So I have been very annoyed with WellCare by Fidelis Care because they call me on the record. They call me so much that between the representatives and the AI calling me the machine and they want you to call them back, it's ridiculous. I understand they don't know my schedule, but I have told them. I sleep during the daytime. The only time I get up is when I got some business to take care of. If I don't have no business to take care of, I'm not getting up. But you'll call me all times a day. All times in the morning. It's like, soon as you get to work, my phone is ringing. I don't want to hear that shit. I don't go to bed till 5, 6 o'clock a.m. I be up all night from maybe 4 or 5 in the afternoon to 5, 6 in the morning. I be up all night because I can't sleep because of my pain. So when you want to call because it's your business day, it's my sleep time. I'm not going to be bothered with you. So you keep calling me, you keep worrying me. Oh, fill out the survey. I'm not filling out no survey. You made a promise with Medicare, and then you call yourself filling out these surveys and mailing me the results of what you saying to the insurance company, what your plan is for me, but it's not the plan I have for myself. Obviously, I'm doing something well. I haven't been in the hospital since 2018. It's 2025. I have had no reason to be in the hospital for no period of time, not even for an overnight visit. So obviously I'm doing something right, and I'm going to continue doing what I'm doing. I'm not going to do what you want me to do because you want to sound medically correct. I don't give a damn about what you're talking about. Y'all don't want to see nobody go to pain management and get pain management meds. You want to give them some old junky ass pain management meds. And then these doctors, they want to count your pills and modify you and regular. Man, fuck you. I can medicate myself. I don't need that. Not that much. I'm not going to put up with it. Okay. But then when you go to your primary doctors or all these specialists, they want to give you all this junky ass medicine. And they want you to keep coming back and listening to their opinions and listen to what they think you should be doing just to keep issuing you this junky ass medicine. The hospitals, the primary doctors, the specialists, the insurance company, and the manufacturers of medications and the pharmacists all work together. I don't give a damn what you say. I'm going to do what I want. This is my life. I'm going to do what I want. I just don't care. You know, so everybody wants to tell me this and tell me that. With the pharmacy, what I do for them, because they'll worry the fuck out of me about medication. They'll rush and fill some medication. I don't want all that shit at my house. I get my medicine once every 3 months. Sometimes I take it and sometimes I don't. Soon as 3 months from the last time I didn't got medication, you're reaching out to me. Oh, it's time to fill this and time to fill that. You know what? Keep it there. I don't want all that junky ass medicine in my home. So I will call you when I'm ready for my medication. You don't have to text me. You ain't got to call me. You ain't got to send me no letters. When I'm ready for it, I'll get it. If I'm not ready for it, I'm not going to get it. Because most of the time, the medicines that you want me to get, either I done took myself off, but because I just don't like the reaction my body gives to the medicine, or the combinations of medicine that I take on a regular basis, or I'm in a high blood pressure study, so I'm not on that medication no how. But the insurance company, oh, you ain't been your high blood pressure medicine. Maybe if you call me and ask me in a nice manner with that, I notice you haven't been filling your high blood pressure medicine, and we was wondering why. Okay, wonder. I got enough medicine to fulfill me, or I'm no longer taking that medicine, period. I might be in a high blood pressure study or whatever. But they try to be so involved that they don't even know what's going on. And I don't tell them shit because it ain't none of their business. Fuck you. Pay me. You know, but in my opinion, it's better to have parts A, B, C, and D so you can get all your medical needs taken care of. Now, this paperwork I'm about to show you, it's considered as an evidence of coverage rider for people who get extra help paying for prescription drugs, also called the low rider subsidiary. I get this in the mail. I used to get it in December, but now I got it now in September, and this is for 2026. And the reason that I get it now is I'm quite sure that the federal government realizes that some of my paperwork was not going out at the right time, because the government's fiscal, not physical, fiscal year is from October 1st to September 30th. Our year is from January 1st to December 31st. So that's why when you work, you can't file your taxes until the January following December 31st, so they can get all that information together. That's the calendar year for most people, for everybody. But the fiscal year, FISCAL, is from October 1st to September 31st. That's the government's year. And they have to have their paperwork and different things together and sent out by a certain time. That's why the month of September is very important. During this month, which I haven't gotten it yet, but I know it's coming. I don't know if it's going to come tomorrow, which is Saturday. I don't know if it's going to come Monday or it's going to come Tuesday. But I know I'm going to have certain things within the last 3 days. Not just me, all of us. You're going to get a Medicare and You book. I reference that book like it's an encyclopedia. It tells you all the upcoming changes for 2026 before 2026 gets here. It tells you what Medicare is going to cover. It tells you what Medicare doesn't cover anymore. It tells you in the back of the book which programs or which insurance companies have a contract with Medicare and the different Medicare programs that they have. Because it's multiple Medicare programs. But I would advise you, if you have Medicare because you have SSDI, you have Medicaid because you're getting some form of SSI, whether you get $1, whether you get $30, whether you get $100, whether you get $500 from SSI, that qualifies you for Medicaid. It also qualifies you for Medicaid transportation, and it qualifies you for food stamps, or SNAP as they call it. Then Medicare has a separate program for people who are low income and their income is limited, and it's considered as extra help. It's a separate program from Medicare. Between extra help and Medicaid, they pay your premium for Medicare because Medicare costs. It's not a free program. It's a free program if you have Medicare, Medicaid, extra help. It's a free program now. And you get a low subsidiary. Because somebody has to pay that premium payment. It doesn't come out my check. If my SSD was much higher, then I would have to pay for Medicare. But since my SSD is low, I don't pay for Medicare. And I'm so happy for that. I'm glad Extra Help and Medicaid put the money together and paid for my premium, because that's almost $200. Okay. So now that you know about these programs, because I done told you these programs numerous times, the SN program, SNP, Special Needs Program, for people who have one or more chronic illnesses. This is a program that's within the insurance company that you pick to handle your Medicare and your Medicaid. So the insurance company I used to have was the United Healthcare. Don't have that no more. The insurance company that I have now is the WellCare by Fidelis Care. And they take care of all my Medicare and Medicaid needs. And I go to their doctors. I picked a doctor some years back to be my primary doctor. She had been my specialist when I was on Medicaid before I became severely disabled. And she found a lot of things wrong with me that my then primary doctor didn't feel like was important. So I figured, well, since I'm no longer going to this primary doctor, let me see if she'll accept me on and be my primary doctor. And she did. And she has done a lot of things that have really, really helped me. And this is why I'm so pissed with her. I recently was scheduled to have an appointment with her. And I usually take the first appointment, which is 7:30. I scheduled the Medicaid cab. They accepted the appointment, and they never came. So being that they never came, I called and said, obviously, I'm not going to make it to my appointment. This is Donna Howard, birthday, blah, 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 all the information she asked for. Could you call me back to reschedule? she won't talk to me, and her office staff act like they can't talk to me or they're limited to say anything to me because I won't pay this $35 for a missed appointment. I'm not paying for that missed appointment. I am not doing it. I don't care what you say. Or if I do pay, you still won't be my doctor because you showed me something that was real ugly. You showed me that $35 mean a whole lot to you. You've been a specialist for many years. You're an internist, so you know how the body works on the inside. And you're a primary, and you worried about $35 funky. You know what? Take that loss, and we're done. I'm not doing it. I don't care. The reason I'm not doing it, because it wasn't my fault. I didn't accept the trip and then couldn't have a driver come get me to go to the doctors, for one. Two, when I take an early doctor appointment like that, I'm standing out in the dark until you open up that front door. And I ain't got no business standing out in the pitch black waiting on you to open no door. Even though the Medicaid cab will let me sit in there, but no, go on ahead, do what you got to do. I don't want you to stop what your money is for me. So that's one issue. Two, when you don't have the first appointment and somebody else has had it and they done scheduled this person and that person at this time, and then they're in there with that patient a little longer than usual and they're not rushing that patient, so now their time is cutting into your time. They don't pay you for being late to their appointment with you. And I'm just not paying. It's just some things in life I'm not going to do. And that one I ain't going to do. I don't pay a copay to go to the doctor. I don't pay a copay for medicine. I don't pay a copay for medical equipment. I don't pay a copay for a doctor. I don't pay a copay for a test. And I'm not going to pay a late fee. I'm just not going to do it. I have done it before with pain management, but we all know what that is about. But I'm just not doing it. And when I get to that point that I'm not doing so, I'm just not doing it. So I put in a complaint with Medicaid, and I put in a complaint with Fidelis Care by WellCare, and they understand that I'm not going back. Clearly, they know that about me. But they will bug you about everything else. They made the mistake of filling out some paperwork on my behalf because I haven't filled it out, and I'm not going to fill it out. Like I told them, y'all call too much, for one. I told y'all to stop calling my cell phone. Y'all take it upon yourselves. Y'all call the house phone. If I don't answer when you want me to answer, you call right back on my cell phone. I'm still not going to answer. I don't even know where a person get that from. That if a person got a house number and a cell phone number, I'm going to call you directly on your cell phone number. You're not going to directly get an answer. Because one, I blocks you off of both the house number and the cell phone number. Two, I have a 24-hour answering service on both. I'm not answering the phone. If I don't want to be bothered, I'm not going to be bothered. Three, I don't like the fact that you give out my cell phone number. So no, you're not going to get answered for none of that. Because now they have it where you don't have to ride through Medicare for transportation to the doctor. You got to take a Medicaid cab. And that works for me because I was so sick of riding so many visits to the doctor through Medicare and then got to switch over to Medicaid. And the last Medicaid company I was working with, now they're no longer driving. Now I got to try to find another Medicaid cab. So for me to just ride Medicaid cab all year round, that's great. Beautiful thing. I'm glad you did that. So you have no reason to call me on my cell phone for no reason. Then you're giving out my cell phone numbers. Then you're giving out my house number. No. We're not doing that. I'm not doing that. I don't know about nobody else. I'm not doing that. Then you're filling out paperwork because I didn't return it when you wanted returned. And it still ain't filled out. It's about to be a whole new year. And I haven't filled out the paperwork. I don't plan on filling out the paperwork. I ain't gonna do it because I ain't happy with them either. I am waiting for the Medicare and U-Book to come out so I can find out what other SNP programs are here in Buffalo, New York. Now, don't get me wrong. I like what the SNP programs do for me. I like the fact that they cover the Part C that I don't have. I like that. So I can get all my tests and all that done for free. I like that. I like that whatever Medicare is giving for your frames and your lenses and your bifocal, they pay for that. And I pay the difference. I like the fact that I get an OTC card and I can go buy food or I can go buy over-the-counter medicine or I can pay a utility bill with it. But I got my utility bills paid the way I want, so I would never stop doing it the way I do it. I don't pay my bills like everybody else. I have Belmonts, which is a form of Section 8 up under the HUD program. They pay the majority of my rent, and I pay the difference. My gas and lights are included. So I don't worry about them bills. My bill as far as my Spectrum bill, which I get my house phone and my internet through, they bill me. And I used to wait for the bill and pay the bill. Now, I wait till I get my income. Whatever day I get all my income, I pay my rent, I pay my Spectrum bill, and I pay off my other little bills. And that's that. And then the rest of that money I got to me. And when I pay my Spectrum bill, I don't give them what they ask me. I give them double a payment. So if they ask me for 90, they gonna at least get 200. If my bill is over 100, they gonna get at least 225, maybe 250. Especially now. In the summertime, you might not. Because I don't pay my bills like most people. Most people pay their bills every month. I don't pay my bills like that. I take what I need for Spectrum and I give them double and a little bit more. I pay them January, February, March, and April because those are the most times that I'm in the house. And it's cold here in Buffalo. So I want to make sure my services is working. In May, it's Mother's Day and my birthday. You ain't getting shit. In June, it's my son's birthday and his wedding anniversary. Plus, he has stepkids, so you ain't getting shit in June. In July is my oldest godson's birthday. You ain't getting shit then. You'll get a payment in August. You'll get a payment in September, October, November, and December. But I don't owe nobody nothing. So it don't matter. Because no matter how many months I don't pay you, they're already paid. Because I'm giving them more than double every time I pay them. So whenever they bill me, my bill is always going to say 0000 because the money is sitting right there. So like last month, August, let me see, I think I had almost $400 credit on my bill. And I gave him $225, so that left him with $600 and something on my bill. It's about to be October. I'm about to give him another $225. So I don't worry about no bills. My bills is covered. They are good. I am the only one paying my bills. I don't have no mate. I don't have nobody paying my bills for me. I don't worry about it. But these insurance companies and these doctors are a pain in the butt. So now, since I didn't put this complaint in against this doctor, I don't want her as a primary no more. I really don't even want a primary. The reason I picked a primary doctor is because sometimes I do need referrals to other doctors. I can refer myself. I can actually call the insurance company and get them to refer me. And don't have to have a primary doctor. But, I have so many different health issues that I deal with. Sometimes it's good because it might be a test I want done that I might ask this doctor or that doctor, and they trying to send me here and there, and I don't want to go here and there. I'm going to go to Catholic Health System. That's what having primary is good for. Sending me where I want so I can have all my medical records in one place. So, since me and the primary ain't getting along right now, I'm not in no rush to get a new primary doctor. And in my case, it really doesn't make sense for me to be trying to get a new primary doctor or any other kind of doctor because I'm not happy with the insurance company. So I'm looking for a new S&P program that all my doctors accept that will give me the amount of OTC that I want. Where it's beneficial to me as a member, that will pay me in gift cards when they want me to do something, whether it's a nurse's visit or whatever. They'll pay me. They'll send the nurse out. The nurse will look at all my medications and OTC and whatever, and take my blood pressure and weigh me and some little bullshit. And then I can pick a gift card that I want. So I usually pick $100 Walmart gift card. But then Fidelis Care don't want to give you many other options to earn gift cards as a member. So since you don't want to give me no options to earn a nice amount, $100 gift card I can do something with. $25 gift card, I can't do shit with it. Well, I could, but, it's not even worth leaving out the house. So I am looking for a new S&P program. And if not, I will go, I don't know where I'm going to go. I don't know if I'm going to go back to United Healthcare. I don't know if I'm going to stick with WellCare. I just know that I want them to leave me alone. I want them to stop calling me. Stop trying to have interactions with me. Stop trying to have conversations with me. Because we are not on the same level. I don't want all that junky ass medicine. I'm so sick of taking medication, I don't know what to do. So just like they don't want you to have a lot of pain management medicine, I don't want that other junky ass medicine. I'd rather not have no medicine and just heal myself through whatever I'm doing, whether I'm exercising, whether I'm eating good, no matter what I'm doing. I'm going to let food be my medicine. I don't want all that crap that they got going on and thinking that they running something and they ain't running nothing. So I just wanted you to know why I hadn't been doing a lot of videos. It's gotten me frustrated. I done blocked the insurance companies off of both my phones. So when they call the house phone, it don't even lead them to me no more. I call the cell phone, it don't lead them to me. And they'll have people call from their private number. And I'll talk to them for a minute. And when I see it's part of the insurance, I'm not interested. I'm not doing it. Don't ask me to fill out no surveys. And they'll be like, okay, goodbye. Because they know I'll cuss them out. I'm just fine. I'm just looking for what's best for me. I am a prepper. I believe in prepping for everything. A lot of people I know, they be like, oh, well, things are turning bad because of Trump and blah, blah, blah. Everything that we going through with Trump, we done went through with every other president. Everyone, whether they Democrat, Republican, Independent, I don't care. I want a president that's for everybody. No matter what race, no matter what nationality, no matter what income bracket. I want somebody that's going to look out for everybody. That's what I want. And so far we haven't had that. And it's okay. I don't care what you do. I got people who be telling me, well, you know, Trump cutting food stamps, and Trump is doing this, and Trump is doing that. And one, Trump ain't doing no more, no less than any other president, Democrat or whatever. And we've had a bunch of Republicans, and we've had a bunch of Democratic presidents, and they've all done the same thing. The only difference is Trump just isn't giving up the time period that was given when I was on the welfare. That's the only difference. And even when I was on the welfare and they gave me the time period, I said, okay, I'll jump in mental health counseling. So I could take my time to do what I wanted. I jumped in mental health counseling. I did some disability center work. I did some parenting classes. I did some things to get myself together and still got out and got myself a job and worked myself off of, I had put myself on, when you work for the disability center and you needed a long amount of time to get yourself together, sheltered employment. So they didn't take no taxes out. So it was, I was still working. I still filed my taxes. They just weren't taking no taxes out. And when I got tired of them, I told them to put me on regular payroll and I go to work and you take the taxes out. But it worked out for me because when I became disabled, I still had 2.5 years that I could have been on the welfare. But who the hell want to be on the welfare for 2.5 years? Because my time limit was 5 years. Trump giving up 2 years. But it was enough time for me to get back on welfare for 4 months so I could get my disability. And that's all I needed. And no matter what Trump do, hoogla boogla, or anybody else as president, I don't care. It does not affect me in any type of way. He can cut programs, which he already said they're not cutting it for the disabled and the elderly, but that's what they say now. That's not to say it's true. So what I'm doing is, I'm doing what I've been doing for the longest. I've done my research. I done figured it all out, what works best for me. While I'm on disability, I need multiple streams of income, and I make sure that income, there's no taxes coming out. It's non-taxable. When I get to the age of 67, which is my full retirement age, or if they push it up to 70, because I was born in 1964, whatever my full retirement age is, when I get back to my full retirement age and I can earn whatever I need to earn, or I can earn as much as I want to earn because I'm at full retirement age and Social Security don't care, then I will go ahead and apply for the program through YouTube where I can get paid like everybody else is getting paid for their videos. Because then I'll have the followers. I have the followers now, don't get me wrong. But you have to keep the followers where, people are studying, following you and engaging with you and stuff. So I might go ahead and do the AdSense program when I get a full retirement age. And I might not. I might go find me a job. I might not. I might start me a business. I might not. Whatever I do, I'm going to always have multiple streams of income. Because that's me. One thing just don't do it for me. I need multiple streams of everything. So I just wanted you to know what was going on with me and why you haven't heard from me in a while. Yes, I do my videos here, and there, but I haven't been as consistent because I have been so annoyed and aggravated with these doctors and this insurance company trying to run my medical when I'm the only one that's going to run it. And I keep telling them, I am not happy with you as a insurance company. And if I have to go back to straight Medicare and straight Medicaid, that's what I'm going to do. Because I was on straight Medicare and Medicaid at one time. And yes, I had to pay a copay for my medication. But they didn't call me and worry me like Fidelis Care is. Fidelis Care wants to prove to Medicare that they're doing a good job. And I keep telling them, you're not making me happy. So you're not doing a good job for me. And I'm not filling out that form. You shouldn't have never took it upon yourself to fill out anything for me because I didn't fill it out myself. It's not that I forgot. It's not that it wasn't important to me. The bottom line, it wasn't important to me. Whatever Medicare wants from me, when Medicare reaches out to me or disability reaches out to me and they ask me questions, I fill out the paperwork and send it directly to them. I've never had a problem. Social Security, disability, Medicare, I've never had a problem. They don't call me, bugging me. They don't send me paperwork constantly. Although I don't want to fill in the paperwork because I feel like if I got to fill in the paperwork, you should be giving me a gift card. But since you're over my income, I go ahead and freely fill it out and send it back to you as soon as possible. But I'm not doing that for WellCare, for them to look good for Medicare. Because they don't send me the paperwork and fill it out for me and then send me the paperwork. I get this paperwork twice a week, every week. I've been getting it since January and I still ain't filled it out. And they made a contract with Medicare and Medicare wants you to fill this paperwork out. Medicare ain't bugging me about that paperwork. You are. I can contact Medicare and tell them just how I feel and they not even gonna bother me. It's the insurance companies. They want to be so involved and telling you this and telling you that and telling you this and making this decision. So you want to do all that, then I'm going to let you do just what you're doing. You can fill out whatever the fuck you want and say whatever you want and whatever, because when Medicare contact me, I'm going to tell them how I feel. So I will be shortly getting the paperwork I need to look into getting a insurance company that I want. And then after I get the insurance company that's offering me what I'm looking for, then I will find me another primary doctor and we will go from there. I just wanted you to know that why I haven't been doing the videos. So now you know. And I will talk to you soon. Please subscribe. Hit that notification bell so you always know when I'm uploading. Share my videos with your family and friends. And leave me a comment. I love interacting with you. Until next time, I'll see you later.